My name is Ben Adams. I am 48 years old. I am an anesthesiologist and I live in Louisiana. I've grown up in this part of the country the entirety of my life. The only sports I play now are golf and occasionally a little bit of pickleball. And I still lift weights 3 days a week pretty religiously. So I had a knee injury that I sustained playing beach volleyball. That was probably about 8 years ago. So I was right about 40 years of age at the time. And I had an injury that damaged the cartilage in my left knee playing volleyball. Went through a number of MRI scans to find what my problem was and realized that I had a problem that was going to require surgery to repair it. Right. So I had a very swollen knee. I had limited ability to walk because of the pain. My knee would catch, it would click, it would bind from time to time from the fragments of cartilage that were actually damaged in my and I knew the repair that I needed was going to require a specialist from an orthopedic standpoint. And so I called and spoke to him. Not only do I know him on a professional basis, but I also know him personally. I seeked out his advice for the type of repair that would be appropriate based on the type of injury I had. I trusted his advice the most, went to Tampa, which is where he was located at the time, to have the surgery performed by him. We knew each other from medical school. We were friends, but I also trusted not only his judgment, but his expertise. None of the surgeons in my area did the type of repair that I needed to have done. I would much rather choose somebody that I trusted and that I knew and that did this type of operation on a regular basis. So I opted to travel further to see somebody with the experience that I was after to do this type of repair. When I spoke to him on the telephone, the way he explained the procedure in detail and the way he had approached numerous athletes in the past that have had similar injuries to this and their results. That kind of spoke for itself, but he's very accessible as a surgeon for me to call, for me to talk to, and to get the information that I needed to feel comfortable with my decision to move forward. So it was a very easy process for me. I spoke with him on the phone, explained what my symptoms were, what the type of injury I had was, sent him my MRI studies so that he could look at those himself to see exactly what the injury type was. After reviewing the MRIs, he explained what my options would be, and he explained the order that he would recommend me pursuing those options in order to get the best outcome. After we agreed upon the type of surgery I needed to have done, we set up an appointment. I met him for the appointment, and then shortly thereafter, I had the surgery, which was a day surgery. And then I traveled back to Louisiana after that point, and then started physical therapy. Throughout the entirety of that time, I would speak to him on a weekly basis, or even maybe more frequently than once a week, to explain how physical therapy was going, the things I was seeing, how my knee was feeling. I did initially 8 weeks of physical therapy after the procedure was done, and the results were good. However, I was an avid runner at the time, and I didn't feel like I was back to my normal ability to run, just from a strength perspective, and just an endurance perspective. So I actually did an extra month of physical therapy to strengthen my leg further. And on my last day of physical therapy, I ran a couple of miles with the therapist as part of my final physical therapy plan. So, to go from difficulty walking, getting around to surgery and back running miles in 3 weeks based on the type of operation that he did and my physical therapy, I say is a pretty doggone successful procedure. So I can do anything I want. I can play basketball. I can play volleyball. Like I said, I still weight lift. I squat. I will leg press. I live life doing exactly what I want, how I want to do it, and without any pain associated in that knee. He is an outstanding surgeon. He's an upstanding man. He's very straightforward. He's very honest. I needed somebody that did sports medicine on a routine basis and did this unique operation to provide me with the best opportunity for the best outcome. And Dr. Hunt provided that for me. But at the end of the day, he's a great surgeon that I trust, that I've had great results with, and I would recommend him to any of my friends or any of my family.